Good evening to you. First up here at 5 o'clock, cases of the flu are expected to start rising this month, and healthcare workers are encouraging you to get your flu vaccine, and here's why. Between the flu and COVID-19, they worry about the potential of a twindemic, battling the flu on top of the coronavirus, and the impact that could have on important resources you count on. WRTV's Alyssa Donovan is working for you with a closer look at the risk this coming season.
Healthcare workers are concerned that a busy flu season may overwhelm emergency rooms. They're doing everything they can to prepare, but they need you to be proactive as well. 27 years working at St. Vincent, and Dr. Louis Profeta has nothing to compare to the COVID-19 outbreak back in March.
I mean, it was so terrifying, the early days of COVID-19. I mean, we were concerned as healthcare providers if, we were going to die, if our partners and our nurses were going to start dropping dead from COVID-19. And fortunately, it hadn't happened.
But now those on the front lines are worried about the effects that a flu outbreak during a pandemic could have on the healthcare system.
Are we going to be able to determine the difference between whether these patients have COVID-19 or the flu?
And whether patients can determine the difference for themselves before heading to the ER.
What we're concerned about is we're going to have a huge rush of patients coming in with influenza that think they have COVID-19, and these are people that probably could be treated at home.
Which is why healthcare workers and state leaders are asking everyone to get their flu vaccine,
so that we can keep you out of the hospital, and God forbid we won't need those hospital beds either for COVID-19, but just in case we do.
In the meantime, they're preparing the best they can.
We ramp up and prepare for influenza every year. I mean, everybody gets vaccinated. We still aren't really ready for a pan-flu epidemic of the type that we looked at in the turn of the century.
The good news, most health experts are predicting a milder flu season just because of all the COVID-19 precautions that are already in place.
To be honest, I think we're going to see one of the mildest flu seasons in history.
I'm Alyssa Donovan, WRTV.
We're not sharing this information with you to worry you. We want you to be prepared. And as you just heard, this could be a very mild flu season. To help healthcare workers continue to practice good hygiene and social distancing, wear your mask. Indiana is still under a statewide mask mandate, and healthcare workers encourage you to get a flu shot. We explain the differences between the flu and COVID-19 on WRTV.com/coronavirus. Right now, there's a flu shot clinic underway at the Children's Museum of Indianapolis. Shots are free to the first 500 people who purchase a $5 ticket to visit the museum. You must buy tickets ahead of time at the museum's website or call the box office. The museum is partnering with IU Health for this event, which runs until 8 o'clock. IU will also hold 4 drive-through free flu shot clinics this month. The first is Thursday, October 15th at Flanner House from 7:30 to 5:30. The Marion County Public Health Department has also announced a series of low-cost flu clinics this month. Vaccines cost $20 for adults and children 2 and older. Shots for children under 2 are free. Medicare and Medicaid is accepted. The first is tomorrow at the Health Department's South District Health Office at 7551 South Shelby Street from 9 a.m. to 4 p.m. The second is Wednesday, October 7th at Old Bethel Church at 7995 East 21st Street from 9 a.m. to noon. These are all walk-in clinics. We have a complete list of flu shot opportunities at WRTV.com.